PNH is a very rare bone marrow disease whereby the bone marrow causes the blood cells to be made incorrectly. The blood cells are made missing an important protein marker on the surface, which means that the cells in the body are then attacked by the body's own immune system. Now, there are a couple of problems with that. Firstly, the burst blood cells cause the hemoglobin to be very, very low, which means that patients have very poor quality of life, headaches, stomach muscle problems, etc. The second problem is that the burst blood cells are likely to clot, and there is a risk of a fatal thrombosis. I went to my GP when I had extreme exhaustion, headaches, muscle cramps and things, couldn't work out what was wrong. After a few months of blood tests and not getting anywhere, I was sent to a consultant haematologist. It took about 1.5 years before I was finally diagnosed with the PNH. At the beginning, with a rare disease, it's incredibly hard to be diagnosed because health professionals cannot know every single rare disease that's out there. So in the beginning phase of my illness, for an entire 1.5 years, I was diagnosed with many incorrect diagnoses. I had several invasive procedures and the doctors just did not know what was going on. I was fortunate that there was a young doctor who was doing a 6-week placement at my haematology department, and he knew the symptoms that I was suffering from. And he also knew about the research work that was being done in Leeds. I have been treated wonderfully by the team down in Leeds and also by the team at my local hospital. The team in Leeds are there to educate me, to show me what research is being done, to help me with all the medication that's available, and to make sure that I have no questions that are left unanswered. My local team help me on a fortnightly basis with the actual drug that I'm having infused. And again, they're there if I have any niggling issues on a daily basis. So I have found that once the local doctors understood what the condition was, they took the time to learn about it and were in fact very interested in it. I had learned a lot about the condition myself and was able to pass on some of those details to them. It can cause some difficulties though, being under the care of 2 separate health trusts, because the local doctors can often feel a bit threatened by that, because obviously they are used to being in charge of a patient and managing the care of that patient, but I'm very much under the care of the specialist PNH consultant down in Leeds, who, by the very nature of the fact that he has done about 10 years of research into my condition, he is the expert. The day I was diagnosed, strangely, was a great day for me. It was actually a huge relief to know what was wrong with me. I found not knowing the 1.5 years of being tested and being given wrong diagnoses, I found that incredibly stressful. So the day I was diagnosed was in fact for me a really positive day, because although it wasn't wonderful news to be told that I had this rare life-threatening bone marrow disease, I knew what I was fighting. However, the day I was diagnosed was a very bad day for the rest of my family, for my mum, for my husband, for all my family, because they were then faced with the prospect that they could lose me. So for them it was a terrible day, and for me it was actually a very positive day. After the initial days of the diagnosis, I kind of felt that I was carrying the rest of the family because I was incredibly positive and they were finding it very hard. I think as my family have learnt more about the condition through the doctor that I have down in Leeds, he told us everything we needed to know about the condition. He taught us about the condition literally from the bone marrow level right the way up. He looks after all the research into the illness. He understands why it happens and all the medication that's available for us. And I think as my family see me being happy and in control of the situation, that has helped them immensely and it puts their mind at rest. There are a few treatments available for PNH. There are no actual cures for PNH, just some treatments to deal with the symptoms and the issues with the illness. People can be put on warfarin, which obviously is a blood thinner that lowers the risk of a fatal blood clot. People can be put on folic acid because it is known to be a good blood builder. One of the main things that happens to patients when they are first diagnosed is they have regular blood transfusions to deal with the low hemoglobin count. Now, the blood transfusions, usually there are a couple of units every 4 to 6 weeks, which obviously is quite difficult on the body. As I was getting my blood transfusions, and at the time it seemed very difficult, I was developing antibodies when I was having these transfusions, and it was getting harder and harder to match blood for me. My consultant wrote to the Scottish government and asked for funding for me for this eculizumab drug, and the funding was actually granted on the grounds that it was getting harder to transfuse me with the blood that would keep me alive. The final treatment available for some patients is this major, quite new drug called eculizumab, which is a monoclonal antibody, and it is given every 2 weeks in the hospital as a drug infusion over about 2 or 3 hours. I personally go to the hospital for it, although many patients are given their drug as a home delivery. It takes about 2 or 3 hours, and I usually feel slightly tired on the day that I get my drug infusion, but absolutely fine after that. The drug lasts on average in patients about 11, 12, maybe 13 days. We get the drug every 14 days. So when it gets to about day 12 or 13, I can really feel the tiredness kicking in. But the tiredness is nothing like the exhaustion, the absolute exhaustion I used to feel before I had the drug. The eculizumab, the way it works is it disables the complement part of the body's immune system, which means that the blood cells are not destroyed as quickly as they would normally be in PNH patients. The only issue with that is that once the terminal part of the complement is disabled, it means that my body is now unable to fight major illnesses such as meningitis or any of the major diseases, because I do not have that final part of the immune system to cope with major problems. I therefore, and anyone on eculizumab therefore, has to be given regular immunizations against all the major diseases. The time when I was having the blood transfusions just after my diagnosis, it was about a year that I had these blood transfusions, I was exhausted, and it had a huge impact on our family life. I wasn't able to do any of the normal things that you would as part of a family. I couldn't make the meals for the family. I couldn't take my children to or from school. I found it very, very difficult. We relied entirely on the support from our church, from family, from friends. People would literally be dropping meals into us 3, 4, 5 times a week to keep us going, literally so I could feed the family. So we relied entirely on the kindness and support of those around us. When I was first trying to get funding for my drug, I actually hit a bit of a barrier with the local doctors. I think purely because they did not understand the drug. They didn't know enough about it. There hadn't been enough research in their eyes as to what the outcome could be for me if I went on the drug, what the long-term implications would be. And as such, they were incredibly cautious about it and did not want to support me fighting for this drug that I felt would make a huge difference to my life. It's incredibly frustrating when you come up against somebody who says, I'm not willing to support you in this. It is very hard because you're unbelievably exhausted from the illness that you have. So it was quite frustrating in the early stages trying to get the support and the understanding out there for the doctors that didn't know the condition or the drug. Eventually, after I did a lot of my own research and I tried to provide them with some more information, and they did more research themselves, and also my consultant down in Leeds contacted my local consultants. They did agree to support me in my fight for the eculizumab drug. I'm very fortunate that I got that drug just in time, because the severity of my illness meant that had we waited much longer, the drug may not have been as effective as it has been for me. In England, the drug, the eculizumab, is actually fully funded. So anybody that the doctors feel should be on the drug is on the drug. In Scotland, the drug is only by a named patient basis. So in other words, it's not funded nationally and is only given to patients who have a particular reason for needing the drug, as in like myself, where the blood transfusions were getting harder and harder to match, or if there's a patient who's perhaps already had a severe blood clot and therefore they need to have the medication. I am hoping to set up a support group, a Scottish PNH support group, and one of the things that we'll be looking into is trying to encourage the Scottish Government to allow funding for this drug for new patients, but also for patients who are on the drug already to know that they have a future with this drug. My hope is for the future that I would stay on the eculizumab until I perhaps have the benefit of being so well and the PNH clone level dropping to such a point that in fact they may be able to take me off the drug. When I started the drug, I was told obviously that the drug is not a cure and that I would be on it for the rest of my life. But I seem to have been very fortunate in that my condition is improving, and the clone level, which the percentage of how badly I have the illness, has been dropping ever since I started the drug. So for my future, my hopes would obviously be that I would continue on that trend and I would continue to improve the quality of life that I have. The self-management of my illness is very, very important to me. Firstly, the thing that I did to self-manage was to learn as much as I possibly could about my condition, about the PNH, about all the treatments that are available, about all the research that's ongoing. My husband and I would make it our business to find out what papers had been written about the condition and to understand it as best we could medically and statistically, to find out all the statistics. By understanding the condition, by understanding exactly what's going on and all the research that's happening, you feel as if you are in control. I completely rely on the expertise and the wonderful knowledge of my consultants, but in the end, I am still in control. The other thing that I do is I focus entirely on the positive things. In the past, when I didn't have the eculizumab drug, life was in fact very, very hard. I would perhaps collapse and my husband would have to literally carry me up the stairs and I'd have to be in my bed for days. I just had no energy whatsoever. The headaches were bad, the muscle ache was terrible. The ringing in my ears from the problem my heart was having with the low blood count was absolutely horrendous. However, I choose not to think about those. I choose to think of myself as someone who's well. And if I can get to the end of a week and the people around me have forgotten that I'm ill, then I get a huge amount of strength from that.